Lawmakers have been battling it out at the health care summit all day in Washington, D.C. But what do big party politics have to do with our health care here in Oklahoma? Our experts break it down in this week's Your Vote Counts.
One of the greatest lies of all time, the old "hear from the government, going to help you now." And so we're seeing a lot of this in both state and nationally in terms of health care. Both sides get some criticism today, okay? We'll get an equal opportunity offender today. Senator Anthony Sykes in for Randy today.
Glad to be here.
Hey, let's start with the national. They got this health care summit, this PR deal that's going on in Congress. They're both looking at each other like they can't really stand each other, and someone's going to fall asleep. You know, it's remember Clinton falling asleep that time, you know, behind the dais. I would say to you, this thing's probably dead as Julius Caesar, but the president's trying to resuscitate it. Do you think he can?
Well, they're going to keep performing CPR as long as he thinks he's got a shot at this. And what he's using right now is one of the campaign promises, one of the many he had, where he was going to conduct this in public to try to keep it alive a little bit longer. I think the Scott Brown election showed that America doesn't want this, that government is part of the problem, not part of the solution. But they're going to keep trying and trying and trying because they've dug in their heels on this. They're not listening to the voters, and it's time that this change that he's talked about finally goes away.
Okay, so on the national level, this is happening. Now, really, the president has to play to his base, right?
Well,
it has to happen. He's got to do something to keep losing the base.
Here are the facts, folks. Not here in Oklahoma, but nationally, he won an election last year overwhelmingly. And one of those issues is that he was going to address the lack of health care for 41 million Americans and address the overwhelming cost of the growth of health care in this country. In California, they're raising premiums by 35% or more. Folks, this is the bottom line question. Are you better off with the status quo, where you will be spending 25% of your take-home income on health insurance, or are we going to try to do something? The Congress hasn't done anything in 40 years about this issue. The president needs to direct it, and the Democrats in Washington need to get it done with reconciliation, 51 votes, and get it through the door.
Whoa, that's a pretty radical deal.
No, it's not. They've done it many times. Republicans have done it, too.
Okay, we World War III in the politics, they do that. But let me ask you.
Well, they need to do something.
Well, I agree. Something has to be done because of the escalating costs. And let's talk about Oklahoma. There's a bill out there that we're starting to hear a lot of the blogs. Representatives put down press release, SB 1133, that takes away the ability of rural people, to get pain medicine. There's like dozens of counties where there are no anesthesiologists, and people are trying to push this thing forward, going to raise costs, take away people's access to health care. What in the world are they smoking out there?
You know, it sounds like reverse Washington. Some of the Republicans in the House, my good friend Gus Blackwell is claiming, and I think Gus is right, that in the rural areas of Oklahoma, they don't have enough doctors and the delivery of medical care in those areas, and he's trying to protect his constituents. All of this has to do with this one thing, folks. It's about money. Many of the folks that are delivering health care are worried about other people will get the dollar bills. Instead of worrying about delivering health care, the providers, many of them are worried about which dollars are going to be split amongst who. Well, it's all about follow the money.
It really does seem like that. As Forrest Gump says, stupid is as stupid does. If they move that bill, it looks like what they claim the Obama bill does is take away health care, raise costs.
Right.
Yesterday, I guess, Anthony, you guys passed a resolution to keep Oklahoma from having to go into Obamacare, and now we see this. I mean, for Republicans, does the right hand know what the left hand is doing out there?
Well, Scott, Senate Bill 1133 wintered over at the House, cleared out of the Senate last year. I did not support it in the Senate, and now you're seeing the roosters come home to crow over at the House as it's really being examined. Yesterday, we did have some pretty contentious debate and questions on the floor about the resolution that will protect Oklahomans from Obamacare, saying you have a constitutional right to choose your own health care, and so that we're no longer just get sucked into this giant mess they're creating out of Washington.
Well, and we've bipartisan, we've criticized some of the stuff in the Obama bills because, like the Oklahoma Heart Hospital, just
what needs to be done here is that both sides need to get off the political schneid and work together to find solutions and cut it out. Because you know what, Senator? All of us are in this together, all elected officials in this election.
And we're not going to do it together. Okay, we're running out of time. 2 words, work, comp, reform. We hear it about every 15 minutes. I thought we did it in 2005. We're going to have it this year?
Well, we are certainly working hard on it. Senator Harry Coates, Senator Glenn Coffey are leading the charge on this. We've got some bills out of committee that we're going to be looking at. And, the bottom line is work comp costs in Oklahoma are twice of what they are in other states. Talk to any of your business people, they'll tell you the same thing. Had a House rep who's a small business owner tell me he got his doubled and didn't hardly have any claims last year. So it's hitting home. It's taking away jobs. We've got to do something. Most of the stuff in 2005 was struck down by the court, so we're going to have to try it again.
But in all fairness, there's like no place to buy work comp in Oklahoma except for the state.
Well, what's going on? That's right. The work comp source is the only place to go. Folks, this is the deal. They want to deny injured workers the right to be treated by their own physicians, to get healthy quickly and get back on the job. They keep banging this horse is so dead, it's unbelievable. In 2005, when I was there, I was told that we were going to see the last great workers' comp reform. Here it is again. keep your eye on this, folks. They're going to deny injured workers the rights to go to court to seek medical care. That's what's going on. They're protecting corporations. We're protecting people.
Okay, under a minute. We've talked about government and how bad government performs, like these health care issues we've been dealing with. This weekend, a couple of real big events. Pros for Africa on Friday night, which is great NFL players from Oklahoma going to Africa to build homes and feed people, and Channel 9's involved in that. And then we have Saturday night, Adrian Peterson, who I soon hope to be a Green Bay Packer, is going to have his dinner, and he's going to benefit a lot of, his AD Foundation is going to be benefiting a lot of people here in Oklahoma. Charity is alive and well, but we just have to keep talking about it, don't we?
Well, that's fine. I think charity is great, and AD, keep the ball. You know, you can't be fumbling like that in the NFL championship game. But anyway, I love it. But remember, 1 in 3 Oklahomans needs medical assistance from the state, either Medicaid or Medicare. We are 47th in the nation in income. And food stamps are going through the roof. Government has a place to play. And finally, I want to tell you, folks, the Red Cedar bill was passed last week. Hopefully, I'll get it on the floor and get it out the gate.
Last, who should people support for charity?
Whoever they want to choose. That's the beauty of America. We've got some great events going on that you mentioned, but get out there and get behind the charity of your choice and show that it's a private sector that can really make a difference in people's lives.
Absolutely. Last word for you. Thanks for being here. Back to you.